Student Engagement Technique number 28, the case study, brought to you by Robin Day, courtesy of PIDP 3250. A case study is a carefully constructed story that is used as a teaching tool to demonstrate the application of a theory or concept to real situations. It is the oldest trick in the book and has been used at Harvard for over 90 years. To get a case study going, an educator must create a realistic set of circumstances which will challenge students' thinking, encourage meaningful discussion, and require application of knowledge. They must pose thoughtful questions, decide how the group will report its findings, form the groups, and facilitate some sort of group discussion at the conclusion of the activity. For their part, the students must actively participate. Come prepared to ask questions and explore the topic, apply didactic knowledge to sort the data, identify the problem and issue, and recommend a solution. There are so many good reasons to implement case studies in the classroom. First and foremost, it allows students to encounter real-life situations in the safety of your classroom. They have been shown to improve long-term retention and transfer of skills. It is shown that students learn better from examples. Students are actively engaged for the entire session. They use their problem-solving, decision-making, and analytical skills. It helps them work on collaboration with others and conflict resolution should it arise. It has also been shown to engage shy or quiet students. Do be aware of some of the glitches you can run into. Development of authentic assessment tools can be difficult and time-consuming for the instructor. You may encounter student resistance to these unconventional teaching methods, although the modern learner is often keen to try new things. Students may become frustrated if cases are too complex, so be careful the amount of detail you include when creating your case. The other possibility is that students will arrive for your activities underprepared. You will need to have consequences for this type of behavior. Case studies work well in the sonography classroom because making good decisions is a vital part of our competency. I love to bring students into the lab for a little game I like to call One Question. The activity. Students were placed into groups and were presented with a series of sonographic images that had similar presenting symptoms. In this case, all of these patients had right lower quadrant pain. As a group, they had to decide which patient history questions to ask and in what order so that they could work backwards to determine the beginning clinical question. Students were given lab values, previous history, and additional images if they asked the right questions or were on the right track. At the end of the activity, groups were partnered with other groups to discuss their conclusions and clinical scenarios. I myself facilitated a group discussion and answered questions. As these were real cases for real patients, we went back to the beginning and went through all of the clinical information. I asked the students to perform a self-assessment for their participation. All of the case details and images were uploaded to D2L so the students could review them. The overall feedback was overwhelmingly positive for this activity. History taking is a developing skill in sonography. Students get overwhelmed with all of the potential differentials and can overlook important details. Students agreed that this activity helped them to prioritize information and develop a routine for pelvic history taking. Thank you to my references. This presentation is protected by Creative Commons and can be used if reference is given to the author.